Hello everyone. Today, we're diving into the world of a medication called Gaviscon, known by its generic name, alginic acid and bicarbonate. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Gaviscon is an over-the-counter medication commonly used to relieve symptoms of gastroesophageal reflux disease, GERD, such as heartburn, acid indigestion, and upset stomach. It works by forming a protective barrier on top of the stomach contents, preventing acid from rising into the esophagus. This barrier helps to relieve the discomfort caused by acid reflux and indigestion. Gaviscon is available in various forms, including tablets and liquid formulations, and is typically taken after meals and at bedtime. Warnings: while Gaviscon is generally safe for most people, it comes with certain precautions. It should not be used by individuals with a known allergy to any of its ingredients. Additionally, those with severe kidney disease should exercise caution, as the medication contains sodium and aluminum, which can accumulate in the body and lead to complications. It's important to consult with a healthcare provider if you have any existing health conditions or are taking other medications. Before taking this medicine. Before starting Gaviscon, several factors need consideration. Inform your healthcare provider if you are pregnant, planning a pregnancy, or breastfeeding, as safety during pregnancy and lactation has not been fully established. It's also important to mention any history of kidney disease, electrolyte imbalances, or if you are on a low-sodium diet. Additionally, inform your doctor about any other medications, supplements, or herbal products you are taking to avoid potential interactions. Side effects: like all medications, Gaviscon can have side effects. Some common side effects include constipation, diarrhea, and nausea. These are typically mild and temporary. However, if you experience any severe or persistent side effects, such as difficulty breathing, swelling of the face, lips, tongue, or throat, seek medical attention immediately. In rare cases, prolonged use of Gaviscon can lead to high levels of aluminum in the blood, particularly in individuals with kidney problems. This can cause symptoms such as muscle weakness, bone pain, and confusion. If you notice any unusual symptoms, contact your healthcare provider. Interactions: Gaviscon may interact with other medications. It's essential to inform your doctor about all the medications you are currently taking, including prescription, over-the-counter drugs, supplements, and herbal products. Specific medications that can interact with Gaviscon include certain antibiotics, like tetracyclines, iron supplements, and other medications that affect the stomach's acid levels. These interactions can affect the absorption and effectiveness of both Gaviscon and the other medications. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's or the product label's recommendations when taking Gaviscon. For adults and children over 12 years of age, the typical dose is 2 to 4 tablets or 10 to 20 milliliters of liquid after meals and at bedtime, or as directed by a healthcare provider. It's important to chew the tablets thoroughly before swallowing and to shake the liquid formulation well before use. Do not exceed the recommended dose, and if symptoms persist or worsen, consult your healthcare provider. Avoid: while on Gaviscon, it's advisable to avoid lying down immediately after taking the medication, as this can reduce its effectiveness. Try to stay upright for at least 30 minutes after taking it. Additionally, avoid eating large meals and consuming trigger foods such as spicy or fatty foods, caffeine, and alcohol, as these can exacerbate acid reflux symptoms. FAQ: many people wonder about the age restrictions for Gaviscon. The safety and effectiveness of Gaviscon in children under 12 years old have not been well established. Always consult with a healthcare provider before giving Gaviscon to a child. Additionally, some might ask if Gaviscon can be taken during pregnancy. While it is generally considered safe, it is best to consult with a healthcare provider before using it during pregnancy or while breastfeeding. Closing: that wraps up our overview of Gaviscon. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.